All right, this is our seventh session. I thank you for the time you're taking to hear about motivational interviewing, and I hope that you will find this useful. We are we have been talking about the evoking process, which is the third of the four processes or tasks in motivational interviewing. So that's where we are at the moment. And I've particularly been talking about three sets of motivational interviewing skills that are involved in the evoking task. 2 sessions ago, I talked about recognizing change talk so that when your client says something in this category, you recognize it, you remember it, you know that you heard something important. Then last time we talked about ways to not just wait for change talk, but to invite it. And then today, another piece of this puzzle, which is what's the next thing you should say when you hear change talk? How can you respond to it in a way that encourages the person to continue giving you change talk? So that's our focus today. Remember that you invite change talk by asking open questions, the answer to which is change talk. And you can ask questions about a particular kind of change talk. We've spoke about 7 different kinds. If you wanted to ask about desire language, you might ask, what do you want? What would you like? What do you hope for? To ask about ability language, you could ask, well, how could you do this? Knowing what you know about yourself, how could you do this in order to succeed? You can ask about reasons for making the change. You can ask why it's important and how important it is. People often have done some things that take steps in the direction of the change they're considering. That's what we call taking steps, and you can ask about those. What have you already done that moves you in this direction? What would you be willing to do? And what are you going to do? So these are open questions that just invite the person to speak to you about their own change talk. Also remember that the amount of change talk that you hear and the amount of its opposite that you hear, which is sustained talk, is very much influenced by how you are interviewing the person. So I showed you this study in which we changed counseling styles every 12 minutes. And you can see that change talk goes up and down based on what the interviewer is doing. And the same thing with sustained talk, which we used to call resistance. It goes up and down depending on what the interviewer is doing. Now, that ratio between change talk and sustained talk, we find, does predict whether change is going to happen. And you can influence that ratio. So that's an important thing to remember. In the evoking task, it does matter what you ask. So the questions that you ask will influence the extent to which you're hearing change talk or sustained talk. But MI is not just about asking particular questions. It's what you do next that also makes a difference. So it matters what you reflect. We've talked about reflective listening. And it matters what you choose to reflect of what the client says. It matters what you affirm. It matters what you put into summaries. And those are the things we're going to be talking about today. So how do you respond to change talk when you hear it? I talked about these 4 basic counseling skills: asking open questions, affirming, reflecting, and summarizing. And all of those are things that you can do next when your client gives you some change talk, and they influence whether the person will continue offering change talk or doing something else. So, for example, when you hear change talk from a client, you can ask more about it. You can ask for more detail. You can ask in what ways, or give me an example. So just asking further open questions tends to keep the change talk going. Commenting positively on what the person has said tends to keep it going as well. And I talked about complex affirmations, which are not just commenting on some specific thing that the person said or did, but pointing to some positive strength or attribute that the person has that's reflected in what they're saying. These need to be genuine again, so this is not just something you're making up. You're always listening for what the person is doing well. You're always listening for the person's strengths and positive attributes. You can reflect what the person said, and then you can put it into summaries that we've called bouquets. So each change talk statement is like a flower, and you're listening for flowers, and you're collecting them and holding on to them for the person. And I'll talk more about how to do that. In motivational interviewing, also, you're always thinking just one step ahead and asking yourself, if I say this, what is the client likely to say next? So that kind of thinking, staying just one step ahead, is a crucial part in motivational interviewing. What's the client likely to say if I say this? And you can be considering several different things you might say next. I'll have examples of that too. Then I think I've mentioned before the concept of psychological reactance, the tendency to push back when people give us unwanted advice or uninvited advice, or when we receive some kind of what feels like criticism. So if you tell someone what's wrong with them and what they should do about it and how to do it, the next thing the client says tends to be fairly predictable. Even if they agree with what you said, the next thing they say is likely to be yes, but, and some kind of pushback or disagreement or giving the other side of their ambivalence. And if you do that, you're essentially acting out the person's ambivalence, with you taking the arguments for change and causing your clients to argue against change. So you tell them what they should do. They maybe say they don't want to do that. You talk about how important it is for them to do that. They say it's not really that important. And so you're having this dialogue that I say really is an internal dialogue for the client, but you're externalizing it. And doing it that way is particularly unhelpful because the client is voicing all the arguments against change, what we call sustained talk. And clients listen to themselves even a little more than they listen to you. So if you cause them to be arguing against change, they convince themselves not to change. That's a downside, that's a problem in what we kind of want to do as helpers, which is persuade the person to do what they need to do, to tell them what they need to do. And we do that with the best of intentions. We do that meaning well and hoping the person will make the change. But ironically, the effect of doing that often is for the person to move away from making the change. Now, here's something that we call snatching change talk from the jaws of ambivalence. Ambivalence is kind of people's normal state when they're thinking about whether to make a change or not. So it is absolutely normal for people to think of, I can see a reason to do that, and also I can see some reasons not to do that, all right? And when you hear clients talk to you, you'll often hear both of those things mixed together, even in the same sentence, even in the same paragraph. And what you're doing is preferentially paying attention to and reflecting the change talk that you hear. So it matters what you choose to reflect. And I'll give you 4 examples of that. Here's something a client might say to you about smoking. I really don't want to stop smoking, but I know that I should. I've tried before and it's really hard. What would you reflect? You could reflect, you really don't want to quit. You could reflect, it's pretty clear to you that you ought to quit. Or you could reflect, you don't think that you can quit. All of those are accurate. All of those are part of what the person said. But what the client will say next depends on which reflection you offer. If you reflect the piece that says you really don't want to quit, which they were saying, they will then tell you why they don't want to quit. They'll say more about that. If you say you don't think that you can quit, the next thing the client says will be something about how difficult it is for them, and how they're not sure they're able to. And if you reflect the change talk that was in there, it's pretty clear to you that you ought to quit. They're likely to then say something about why they think they ought to quit. And what they say matters a lot. The words that come from their mouth, they hear them and are persuaded by them. A second example, I really enjoy sweet foods, but my doctor says I should stop eating them. I know why she's worried about me, but I feel really deprived if I can't have anything sweet. What would you reflect? You really like the taste of sweets. You really enjoy it. Perfectly good reflection. You feel entitled to have some sweets in your life. That's also in what the client said. You understand your doctor's concern for you. So all of those things were in what the client said, but think what the client says next if you offer that reflection. You enjoy the taste of sweet foods. The client will talk about enjoying the taste of sweet food. If you reflect the piece of, I feel deprived, you feel entitled to have some sweets in your life. Yes, I do. I think it's really okay for me to do that. The client is now arguing to continue having sweets. And if the reflection you choose is you understand your doctor's concern, then the client's likely to say something about why the doctor might be concerned. So it makes a difference which piece you're picking up. And you're always looking for the change talk in there. This one about drinking alcohol. See, the thing is, all my friends drink. Some of them probably drink way too much too, but if I quit drinking, I don't have any friends. I just stay home. What do you reflect? That would be pretty lonely. Quitting would cause a whole new problem for you. Perfectly good reflection. Or at the same time, you recognize that you and probably some of your friends are drinking way too much. Now you can see from the pattern here that what the client says next will be different depending on which thing you reflect. And when you hear the change talk, and when that's what you reflect, then the client tends to continue talking about the reasons for change. And one more. This is now a primary care physician seeing a patient who's in pain and has been prescribing pain medication and is getting worried because the pain medication is addicting, potentially addicting. So the patient says, I know you're worried that I'm getting addicted, but I guess I can see what you mean, but I really need more pain medicine. I don't know how I could get through the day without it. And if you won't prescribe it, then I'll find somebody else who will. Where's the change talk? There it is. You understand my worry about dependence. If you say that, a good guess is the client next will say some things about how they do know that getting addicted is a possibility. But a different, perfectly good reflection is, it's hard to imagine how you'd get through the day without more medicine. In which case the client will say more about how they'd have a hard time getting through the day without the medicine. Or you could say one way or another, you're going to get more medicine. In which case the client will tell you how they might do it, how they would get medicine if you don't prescribe it. So hearing the change talk and responding to it, this is one of the skills in motivational interviewing. Now, there's something about pushback that can hook you, if you won't prescribe it, then I'll find someone else who will. Oh yeah, well, then you want to push back against that. But don't argue with the sustained talk. That just strengthens it. It's listening for, hearing, recognizing, affirming, reflecting the change talk that helps the client keep talking about change. So using reflection as a way to keep the change talk flowing, to keep it going. And that's what you're trying to do, to help the client keep telling you their own change talk, their own motivations for change. They don't really need much to hear your thinking about why they should change. I mean, some of that is fair enough, but the most important things are what the client says about their reasons for change. And this is the way to keep it moving. So here, remember, in order to know what's change talk, you need to know what the focus is, what's the goal. And the goal in this example is to spend more daily time in the practice of meditation. So you might ask, why would you want to do that? Why would you want to spend more time in meditation? You're asking an open question, the answer to which is change talk, and that's what you hear. Well, I just feel better when I start my day with meditation. So it's change talk, actually a reason that the person's giving you. How do you respond to that? Really? In what ways do you feel better? So here's an open question. You're asking for elaboration. You're asking for a little more detail about how they feel better. You're curious. You want to know more about the change talk. Well, I feel more peaceful, more centered. I'm not starting out the day irritated. So that's change talk. Like your spirit is rested. That's a guess. It's kind of a metaphor for what the person's saying. And the person says, yes, and gives you more information. Yes, and I'm easier to be around. A different argument for change. So you reflect that. You want to be a peaceful presence for others. You care about how you affect them. That's good, deep listening to what the client is telling you. So there's a reflection in there and also an affirmation. You care about this. Mm-hmm. Yes, I do. It's better for my own spirit and for those around me when I practice meditation. So more change talk. So that's the rhythm you're looking for, that you hear change talk and then you respond to it in a way that encourages the person to continue talking to you, to continue giving you examples of their own change talk. Now, what's going on for clients? I'm going to say this twice during this time because it's important. When you invite change talk, when you ask an open question, the answer to which is change talk, clients hear themselves arguing for change. They hear the words coming from their own mouth. And clients have told us this. You know, when I hear myself saying this, it's powerful. I really mean this. You know? So just asking the questions, you're inviting people to give you change talk and they hear it. Then when you ask for elaboration, they say more and they hear themselves saying more, giving more arguments for change. And then if you reflect what they said, they're hearing from you their own speech again, their own language again. They hear you reflecting what their motivations for change are, and they're likely to say more about it. And if you offer an affirmation, they also tend to continue giving you change talk, and they hear themselves making these arguments. That's one of the things that seems to really work in motivational interviewing. When people make the arguments for change themselves, not just you making arguments for change. Now, what about giving summaries? Well, I use the analogy of bouquets, of pulling flowers together, as I said. So thinking of every piece of change thought that you hear is like a beautiful flower, and you remember it and you hold on to it. You're collecting these. You don't necessarily do something with it immediately, although you can reflect it, as I said too. But when you have a few flowers, you can offer a small bouquet back. I learned that florists in English call these posies, just a little collection of flowers. So one thing that you enjoy about meditation that seems important to you is that it helps you to feel peaceful, to start off your day well. And also, you think it improves the way you're relating to other people as well, that you're not coming across as edgy to them, that that they respond differently to you. What else? Now, there's a classic little small motivational interviewing bouquet. You've given the client two things they've said that are reasons for change, and then you ask the simple question, what else? And the client is likely to then give you more change talk. Yeah? As they do, you build larger and larger bouquets, which means you need to remember the things the person is telling you also. And a large bouquet can be the way you finish a session with a client. You've been talking to them in primary care for 10 or 12 minutes, and you pull together all the things they've said. So that's one way to use a larger bouquet. So let me tell you the things that I've heard you say, and let me see if I got it right. You're kind of announcing that the session's coming to a close, you know? Or you're wanting to shift and talking about something else. But you might say, no, but before I go on to the next topic, I just want to pull together the things you've told me so far to make sure I understand them. And then you give them a summary of the change talk, right? Or we'll talk later in this course about the planning process, the planning task. And when you're preparing to take the step into planning, that's also a good time to pull together this larger bouquet and remind the person of all the reasons they have told you for why they might make this change. So those are at least three different places where you could use a larger bouquet. My friend and colleague Terry Moyers prefers the metaphor of a box of chocolates. So when she talks about change talk, she says you're collecting chocolates, kind of putting together a box of chocolates, and periodically you just show the person the box that you have and say, now here are the things you've told me so far. Now, another perfectly good metaphor for what's going on here. So in motivational interviewing, giving a summary pulls together the client's own change talk. And that's an important thing. It has a real impact. So let me give you an example with a different focus, a different goal. So the person's been talking to you about that they're considering becoming vegetarian. So you ask them, what changes have you been considering for your health? And they raise the topic, I've been thinking about becoming vegetarian. Well, what got you interested in doing that? You ask with curiosity, with interest, It's an open question. And you're asking them to give you reasons for why they're thinking about this. In other words, it's a request for a particular kind of change talk. Well, I heard you can actually reverse diabetes that way, says your client, giving you reasons, giving again some change talk. Oh, you have diabetes, something you didn't know. Just a simple reflection. Well, pre-diabetes, my doctor said, and I don't want to become diabetic. There's change talk. One reason that you're considering being vegetarian is to prevent diabetes. What else? Or anything else? Just asking, tell me more. Well, I think it's just better for your health to avoid eating meat. I already don't eat beef or pork. Change talk, taking steps, already moving in that direction. You're partway there already, you say. A little bit of encouragement. And why is that? Why are you not eating beef or pork? It's a complex reflection, open question. Well, a lot of my friends are vegetarian, and they don't approve of killing animals for food. Now you've learned something else. So it's not just the health benefits, although those are important to you, especially to prevent diabetes. You also have some moral or spiritual reservations about eating meat. What you've done is given a smaller summary. You pull together the pieces that you've heard so far. That's right. And if it's violent to slaughter cows and pigs for food, then why isn't it cruel to kill other animals? The client says. That seems arbitrary to you. A complex reflection. It doesn't make sense. It's inconsistent, you say. And also, you said that a lot of your friends are already vegetarian. What else have you thought about in terms of becoming vegetarian? There's a little summary and continuing the summary and then asking an open question, inviting more change talk. Well, meat's more expensive to buy, and my friends say it's bad for the environment. Uses up more resources to raise animals for food. So now the person's giving you yet another reason they've thought about. So here's a larger bouquet or box of chocolates. You've thought about this a lot. Let me see if I understand where you are with this. You think being vegetarian would be better for your health and might keep you from developing diabetes. It's more expensive, costs more for you to buy meat, and also it's less sustainable for the environment. Then there's the moral or spiritual principle of nonviolence and being consistent with that value. You avoid beef and pork, so you're already partway there. And you know it's possible because many of your friends are vegetarian. Now, all of these are things that your client has told you, but there's something about pulling them together for the person, their own language, their own motivations, that's quite powerful and difficult for people to do on their own often. So again, what's happening for clients? You invite them to give you change talk, and they do. They hear themselves arguing for change. You ask for elaboration, and they elaborate. They hear themselves saying more. You reflect what they say, and they hear you saying their motivations again. You affirm what they say, and they hear themselves saying more. And when you offer these kind of summaries, when you hear all these motivations for change pulled together, that's an unusual experience for people. And it's hard to do when you're just thinking about change yourself. Because when you're thinking about change yourself, the normal thing is to think about a reason why you might make the change. And then the next thing normally is to think about a reason why you don't want to make the change. And then to stop thinking about it, because that's kind of unpleasant. You're helping people do something that is a little harder to do on their own, a little more difficult to stay with just on their own private time, although it's possible. I was a leader in Boy Scouts, and we would go into the forests, and one of the things that we taught boys was if you're in the forest and you don't know where you are, you're not sure how to get out, don't just start wandering, because you probably will go around the circle and you find yourself kind of back where you started again. So what you need to do is to move in a straight line. And if you keep moving in a straight line, you'll eventually get out. So how do you do that? What we said is you line up 3 trees in your line of sight. You pick a tree close to you, and then one a little farther away, and then one more in the distance that all lie in a straight line. And you walk from tree number 1 to tree number 2, watching tree number 3. When you get to what with tree number 2, still looking at tree number 3 beyond it, now you look past it and find another tree in a straight line. And now you walk in that straight line. And when you do that, you keep moving in the same direction. Now that's a metaphor for what you're doing in motivational interviewing. You're helping people to go from tree to tree to tree in a fairly straight line, to keep talking about change and their reasons for change. And doing that has quite a powerful effect. Okay, so now you've given one of these larger summaries. What do you do next? Actually, there are a number of things. You can give the big summary and then just wait for a bit. Just wait in silence. Let it percolate for the person. Let them think about what you've said, and just wait for them to say something next. You could ask what else, asking for still more reasons after hearing a summary. Or you could ask what Steve Rolnick and I have called a key question. after your summary. And the essence of a key question is, so what's next? You know, it might be, so what are you thinking at this point? You've just given them all these reasons for making the change that they're considering. And you say, so what are you thinking at this point? Or what do you make of all this? Or what are you considering? Or what do you think you'll do? We used that question earlier in an exercise in this course. What do you think you might do? What do you think you could do? There is so many different ways to do it. Lots of different possible key questions. But it's posing the summary for people of their own motivations and then asking an open question that invites them to kind of think, what next? So what I want to do now is, as a way of integrating these skills, is a demonstration again. I'll be asking you for if you were the person having a conversation with me, what would you be talking about? What's a change that you want to make, that you hope to make, that you would like to make? Doesn't have to be a problem, can be an opportunity, you know. Think about going back to school, whatever. That having that topic makes it easier for both of us to land on change talk because you're already kind of wanting to do it in some way, right? And more difficult topics come later in the course, so that's okay. But starting with something that you want to, a change you want to make, makes it easier to demonstrate this particular step in the process. And after this demonstration, then you'll have a chance to try this yourself in breakout rooms. But my task in the conversation is to invite the person to offer change talk and to respond to the change talk that I hear in the ways that I have been talking about it. And I may even pause in the midst of the interview and comment a little bit on what's happening. But everyone else, besides the one person who's talking to me, your job is to pay attention for change talk and to be asking yourself, what is it that seems to invite change talk? What seems to evoke change talk? What seems to help the person to be giving more change talk? That's the thing to be paying attention to when you're watching a demonstration like this. So now it's your turn. This is just going to be 13 minutes of practice, so not very much time for pain here. And again, in each group, in each breakout room, someone will offer to be a speaker. Could be more than one person also. But again, a change that you want to make, a change that you hope to make, something you would really like to make. And again, it doesn't have to be a problem. It could be an opportunity. It could be something that you really want to do. And there'll be one interviewer, so a second person volunteers to do what I was just trying to do, to interview the person. And I'll come back to each of these roles. And then there'll be one primary observer. One person says, I'm going to be responsible to be the primary observer and decide who will take each role, and just take not more than a minute to choose those roles. And here are the roles. If you're the interviewer, you'll have 10 minutes to do the kind of thing I was doing, asking open questions that invite change talk. Listen well to what the person's saying. When you hear change talk, respond to it by asking for more. How could you do this? Affirming what was there. Reflecting what the person is saying, reflecting their change talk. Offering a summary, pulling together the pieces of the change talk that you hear. So those are the things to be keeping in mind when you're the interviewer. And I'm not going to ask you to remember it all and do a grand summary at the end. That's a still more challenging thing, and we'll get there, you know. But I'm going to have somebody else do the summary this time, which is the primary observer. All right. So if you're the interviewer, just relax and use the oars. Ask open questions, affirm, reflect, offer short summaries to help the person pull together their own change talk. Right? If you're the primary observer, here's your job. Listen carefully and take notes. So I would want to have a piece of paper in front of me. take notes of the change talk that you hear. What's the person saying that helps them move toward the change they say they want to make? Remember the categories: what desirability, reasons, need, activation, taking steps, commitment. It could be any of those things. And sometimes it's change talk that doesn't fit into any of those categories, but you still know it's change talk. It's still saying, it's still moving in that direction. When the 10-minute interview is over, and the staff will give you a signal that it's over, then it's time for the primary observer to give a 2-minute summary of all the change talk that you heard. So you'll be speaking to the speaker. Just say, so you, and give a summary of all the change talk that you heard, which essentially is what the interviewer does at the end of one of these interviews too. But I'm letting the observer really focus on and take notes on all the change talk, so the interviewer doesn't have to do that in this round. I'll just comment that the next time we meet, I'll be going through in detail, I think, one of the best recorded examples of motivational interviewing that we have, applying all the things that we've talked about so far. And why is the interviewer doing what she is doing? What's actually happening? So it's a good example of what can be the benefits of having a recording to go through. And I want to thank my colleagues in Bangalore for making this all happen and work so well.